When I see a patient in my office, I was taught back at Cleveland Clinic when I trained, did all my training. I had some great doctors teach me, and one of them struck me one day. When a patient comes in, and they come in, they have a chief complaint, say, of low back pain, I talk to the patient, I go, right, instead of the medical history, I talk about their social history. I want to get to know them as a person. You know, their marital status, occupation, do they smoke, they drink, and most importantly, what are their hobbies and what they like to do. I think it opens up the doctor-patient interview a lot better, and I can get a lot more information. But every patient of mine, whether a professional, recreational athlete, or just one of my internal medicine patients, I talk about nutrition and exercise. I want to know where they're at right now. To talk about any restrictions with their nutrition, speed work, whether they're a professional, recreational, or even an everyday athlete. Remember, as you get older, your reflexes go down, speed goes down, so it's important to add that into your exercise routine. Strength training in all forms, cardiovascular endurance, aerobic activity, core stability, the hips, the back, abdominal area. And then rest and recovery is very important in a healthy population, but even more important in MG, as we'll talk about. And then flexibility. A little bit of physiology and how the body works so that you understand some of the research later on. When you start to exercise, the first 15 to 20 seconds you use what's called ATP. That's the energy substrate that makes exercising muscles contract, and creatine phosphate. After that time, up and through to 60 seconds or in a few minutes long, you go into what's anaerobic glycolysis. The carbohydrates you have stored in your muscles and liver start to use that as your exercising energy. And then after that, we move into what's aerobic metabolism. So the carbohydrates are still present, but there's more fat ox. So the fat you have stored in the muscle and in the soft tissue becomes your energy substrate. And that can go on for 45 minutes to an hour, even longer. Let's look at some of the tissue changes that happen when you exercise. The exercising muscles can increase up to 25% in their muscle fibers. The ratio of capillaries, so increased blood flow, increases as well. And the size and the availability of the cells increase. Oxygen changes, the VO2 max, which is actually a unit we do and look at. It's the maximum amount of oxygen that's consumed in an exercise period. It can increase up to 15 to 25%. And some subjects will be non-responders to exercise in this unit, and some will be over-responders. And increase what's called the lactate threshold. That's where you get that muscle burn when you're exercising. And what we do in my office is my physiologists, we design programs based on these VO2 max and anaerobic thresholds for my medical patients. I'll have a patient with emphysema or osteoporosis or diabetes, and we want to improve their performance and their metabolic activity in their body. And lastly, so again, the strength training, the anaerobic will increase the greatest adaptations in muscle fibers as well, and certain fibers will be increased with aerobic exercise. So it can be very important to improve that for tasks of activities of daily living, improve endurance for athletes, play a role in weight control, and et cetera. Now let's move into the nuts and bolts here. We're going to talk first on anaerobic resistance strength training studies and then aerobic studies. Whole body cooling. This just came out last month in the Medicine and Science and Sports and Exercise, which is the Journal of the American College of Sports Medicine. It's been thought that local muscle cooling has been shown to reduce the symptoms in neuromuscular disease. And so this study was done to determine whether lowering the body temp using a cooling vest would improve their muscle strength, subjective perceptions of weakness and fatigue, pulmonary function testing in patients with generalized MG. So they had 5 females and 1 male. It was a small study who had MG from 29 to 58 years old. A cooling vest showed a mean body temp lowered 34.9 Celsius and a normal body temp 35.8. So it lowered it that much. Then, once they were able to lower it, they looked at isokinetic and isometric muscle strength and endurance, and they were measuring that in the upper body muscle groups. They looked at scores of the myasthenic muscle scores, fatigue impact scores, pulmonary function testing, and they monitored the skin and core body temperatures. The mean body temp was decreased significantly, 30 to 45 minutes of cooling. The MMS and the maximal inspiratory pressure increased significantly with cooling. There was improvement with grip strength, fatigue ratio, wrist extensors, rotator cuff, forced vital capacity, and maximal expiratory pressure, all pulmonary function tests. So from results-wise, the limitation of the study, it was a small study of only 6. There are fluctuations in the subject's MG attacks. Most of the exercise was performed in the morning. That's when most patients feel best. Be interested to see how if they did the exercising later on in the day. But the overall party line was consider cooling exercise in the morning with patients with MG. Another study, this is early 90s, 11 patients with mild to moderate MG were subjected to strength training programs, up to 30 sessions over a 10-week period. They looked at maximal muscle force, degree of fatigue during repetitive maximal isometric muscle contractions. And they measured them in doing knee extension for the quadriceps, elbow flexion for the biceps, and elbow extension for the triceps. They found that most of the subjects didn't have any adverse effects or discomfort. 23% had an increase in maximal voluntary muscle force compared to 4% on the untrained side. Had a positive effect, most subjects, on both max muscle force and on endurance. The limitation of the study was it was a short 10-week study with a low workload, so I'd be interested to see if they had a higher workload. But again, it's information here we gathered. Dynamic training schedule with submax loads rather than imitating endurance training. And what is known is that in MG, repetitive nerve stimulation is used to detect a defect in the neuromuscular junction and its transmission, but this provides no information on the change in muscle strength or on fatigue. Knowing now that we talked about before how muscles respond to exercise, you have a little more information on possibly overcoming the neuromuscular junctions defect, and that you can get some changes in the muscle and the capillaries, et cetera, that goes along with exercise. I brought in the next part of resistance is creatine. It's a supplement that's used, and there's some training, resistance training and creatine studies that are out there in Myasthenia Gravis. Creatine monohydrate, and I use this, my talk from I have a sports supplement talk I give to the team docs and coaches. The creatine's the most well-studied supplement in history. I went to the original ACSM meeting back in the mid-90s, and you had probably every TV and mass media outlet was there, and you couldn't even get in the door. It was that exciting in our realm of sports medicine. But there's some implications for it, I think, in neuromuscular disease possibly. What it is, it's a non-essential protein, meaning your body doesn't make this protein. It's made from 3 amino acids, arginine, glycine, and methionine. Your body makes itself 1 to 2 grams a day. You can get another 1, possibly 2 grams a day in your diet. And remember that energy system slides I showed you, it's going to work on that initial 15 to 20 seconds where ATP is regenerated as your energy substrate and creatine phosphate. And so it allows for quicker regeneration of ATP and recovery with the phosphocreatine. A lot of the randomized studies have demonstrated increased lean body mass, high intensity power output, and strength in healthy humans. The mechanisms are thought to be due to the increased intramuscular phosphocreatine, energy shunting, and protein synthesis stimulation. It's dosed. You can either load it with 20 grams a day for 5 days, and you go to a maintenance dose of 2 grams. It's in the form of liquid, powder, gels, anything, pretty much every type of substrate. Or you can go to 3 grams a day for 28 days. And some of the studies showed that 20 grams a day had no benefit above that. Co-ingesting with a carbohydrate helps increase the creatine stores.